Good morning, students. I'm Dr. Hariharan, working as Associate Professor, the Department of Community Medicine, Sree Balaji Medical and Hospital. Today, the topic that we are going to see is cross-sectional studies. It is an important study design. The specific learning objectives for this session would be, at the end of the session, students should be able to define what is a cross-sectional study, enumerate the various steps in conducting a cross-sectional study, describe about the uses, advantages and disadvantages of cross-sectional studies. The contents for today's presentation will be, first we'll be seeing about epidemiological study designs, introduction to cross-sectional studies, steps in conducting a cross-sectional study, the ways of conducting a cross-sectional study, uses of cross-sectional surveys, advantages, disadvantages of cross-sectional studies. First, we will see the epidemiological study designs. Broadly, the epidemiological study designs are classified into two types: observational studies and experimental studies. Under observational studies, we have got several study designs, and under experimental studies, we have got randomized control trial, non-randomized control trial. Under observational study designs, we have got two important classifications. One is descriptive studies, another one is analytical studies. In descriptive studies, we simply describe the disease with respect to time, place and person. In analytical study designs, we have got four types. The number one is ecological studies, number two is cross-sectional studies, number three is case control studies, number four is cohort studies. These cross-sectional studies are an important tool in studying the disease prevalence and its etiological factors. They are also useful for hypothesis generation, whereas case control and cohort are useful for hypothesis testing. Moving on to cross-sectional study. Cross-sectional study is a study that examines the relationship between diseases or any other health outcomes and other variables of interest as they exist in a defined population at a particular point in time. This point is very important, particular point in time. In a cross-sectional study, we do the study in a defined period of time. We do not follow up the patients. Cross-sectional studies are also called as prevalence study or disease frequency study. In this slide, from the picture, you can appreciate that a person is taking a screenshot of the population at a particular point of time. This is what the cross-sectional study is all about. Here, we take a screenshot of the population at a particular point of time. We take a sample of the population and try to infer what and all health related characteristics we want from them at a particular point of time. The principal characteristics of a cross-sectional study is that they provide information on the prevalence of disease, that is, they include prevalent cases. Cross-sectional studies are carried out on a representative sample of the population. Here, they are more suited for prevalent cases. Prevalent cases means old case plus new case. That means They are very much suitable for studying non-communicable diseases, chronic diseases. The fundamental concept in a cross-sectional study is, here we are doing a study only on a sample of the population, and whatever the analysis, whatever the result that we are getting from the sample, we are extrapolating to the reference population from which the sample is taken. For example, somebody wants to know about the taste of an apple. What we do? We take a slice of the apple, eat it, and if we find the slice to be sweet enough, we will come to a reasonable conclusion that the entire apple would be sweet in taste. Similarly, from a community of people, we take a sample of the population, we ask them questions, derive data, analyze it, and whatever the data we are getting, the results we are extrapolating to the reference population itself. Cross-sectional studies. In cross-sectional studies, data from the subjects are collected only once and the subjects are not followed up. In cross-sectional studies, both the exposure and the disease are measured at the same point in time, simultaneously. Objectives of doing a cross-sectional study: to find out the prevalence of disease or outcome of interest in a population at a given point of time, to find out the association between risk factors and outcome of interest. What are the various steps in doing a cross-sectional study? Number one, clearly specify the objectives of the study. For example, in my thesis, which I did on under 5, the topic for my thesis was the prevalence of under 5 malnutrition along with its risk factor in Anagaputhur area of Kanjipuram district. So what are the objectives? Number one, I want to find out the prevalence of under 5 malnutrition. Number two, I want to find out the various risk factors associated with malnutrition. Clearly specifying the objectives will guide us in making the questionnaire, doing the research, compiling the data, analyzing the data, and publishing the data. The entire study is dependent upon the objectives. Then comes the define the disease or condition. In my study, I have taken malnutrition as the disease. So we need to clearly define what is malnutrition. In my study, I have clearly defined any child with weight for age less than 2 standard deviation of the WHO mean is called as underweight child. Underweight is a type of malnutrition. So like that, so on and so forth. We need to clearly define what is the disease that we are going to study. Third, define exposure bar risk factors. In my study, the risk factors which I would like to study were exclusive breastfeeding, time of initiation of breastfeeding, how many children the mother had, what is the mother's nutritional status, what was the mother's economic status, did the child receive vaccination, so on and so forth. So I would like to study so many risk factors which were associated with the particular disease. Number 4, identify the reference population. In my study, the reference population was children belonging to Anagaputhur area of Kanjipuram district. Next step is define the inclusion and exclusion criteria of subjects to be included in the study. So clearly, I have mentioned in the title itself, my inclusion criteria will be children less than 5 years of age. Exclusion criteria would be those children who are severely ill, terminally ill, and mentally retarded. This inclusion criteria and exclusion criteria will keep changing depending upon the study topic that we do. Next comes the sample size calculation. Sample size for a prevalence study like cross-section study, usually is dependent upon the prevalence of disease in that particular state, community, or the country. For that, we need to do a literature review and find out what was the previous prevalence of the disease. From that prevalence, we can calculate the sample size. Okay, using Dobson's formula, n is equal to 4pq by L square. This is the Dobson's formula. And of course, the most important thing is we need to know about the prevalence of that particular disease from previous studies through literature review. Next comes the selection of study subjects through appropriate sampling procedure. So, say for example, in the Anagaputtur area, there are about 1000 under 5 children. We need not do or collect data from 1000 under 5 children. We need only a representative sample from that. Say for example, our sample size is 300. So, through a random sampling technique, we will select 300 under 5 children and will collect data from them. That is enough. The data that we are going to collect from them will be of very much use. We will analyze them and publish the results. Whatever the results we are going to get from the sample that we are taking, we can extrapolate it to the reference population. Next comes the creation of data collection instruments. In this study, we are using questionnaires, which are validated questionnaires. The questionnaires will contain questions regarding the child's height, weight, birth weight, and also many questions regarding the socio-demographic characteristics and also the risk factors which we are trying to study. Then we need to examine the ethical issues, and of course any study has to be proceeded only after getting the ethical committee clearance. Then we need to train the staff regarding how to collect data properly, how to examine the children properly, and how to collect height, weight, and other required data. Then we need to train the staff. We need to get the consent from the mother or the study population, and the interviewer should clearly administer the questionnaire in the local language of the participant. Then next step is data collection, analysis of data, and interpretation of the data findings. I'll report it. So, in the analysis of a cross-sectional study, we have got, for descriptive component, we do mean, median, standard deviation. For the nominal data, we do prevalence rate and proportions. And under the analytical component, for continuous variables, we do correlation regression. And for nominal data, we do odds ratio and prevalence ratio. In this particular example, I have drawn a 2 by 2 table. This study tries to find out the association between the use of contraceptive pills and development of breast cyst. In this study, from this table column, you can appreciate that the first column represents those people with breast cyst. The second column represents those who do not have breast cyst. The first row represents those who have been exposed to contraceptive use. The second row represents those who have not been exposed to contraceptive use. We can clearly appreciate that the total number of cases, that is the breast cyst cases in this study population, is 210. The total sample size in this study is 5,891. From this tabular column, we can analyze Number 1. Prevalence of breast cyst among women. Out of 5,891 total population, 210 had breast cyst. So the numerator will be A plus C, that is 210. The denominator will be 5,891, which comes to about 3.4 percentage. Then we can analyze about the prevalence of breast cyst among those who use contraceptives. For that, we need to divide A by A plus B, that is, among those who have used contraceptives, that is 3,247, 124 people developed breast cyst. So A by A plus B is equal to 3.8 percentage. Next, we will get data on prevalence of breast cyst among those who do not use contraceptives, which is C by C plus D. Among 2,644 people who did not use contraceptives, only 77 developed breast cyst. So 77 divided by 2,644 is 2.9 percentage. Then we will derive information on prevalence ratio, which is nothing but the ratio of prevalence among exposed divided by prevalence among non-exposed, which is equal to 1.31. And we can also calculate odds ratio, which is nothing but cross product ratio, AD by BC, which comes around 1.32. Those who use contraceptives are 1.3 times more at risk of breast cyst than who do not use the contraceptives. So we can analyze the data from a cross-sectional study and infer the data with respect to these different types of prevalences. So what are the uses of cross-sectional surveys? The most important use of a cross-sectional survey is to find out the prevalence of a disease or other variable of interest in the population. Repeated cross-sectional surveys may be used to determine changes in risk factors and disease frequency in populations over time. Cross-sectional surveys, the data that is derived from these surveys can be used for finding out any association between risk factor and disease in order to generate hypotheses. Cross-sectional studies are of particular value in infectious disease epidemiology, in which the prevalence of antibodies IgG, IgM against infectious diseases, when analyzed according to the age or other variables, may provide evidence about when and in whom an infection has occurred. What are the various advantages and disadvantages of cross-sectional studies? Number 1, they are easy to perform, quick, reliable, less resources are used, and we can easily train the health workers in carrying out cross-sectional studies. And most importantly, they are useful for generation of hypotheses, whereas case control studies and cohort studies are useful for testing the hypothesis. What are the various disadvantages of cross-sectional studies? Number 1, in a cross-sectional study, we simultaneously study both the exposure and outcome. So we cannot establish a temporal relationship between the risk factor and disease. Therefore, we cannot very clearly tell that so and so risk factor has caused so and so disease. That is a disadvantage. Second, of course, it is not used for hypothesis, it is used for hypothesis generation. And also, cross-sectional studies are subject to few biases like selection bias. If you are not using a random sampling technique, it can lead to a selection bias. Second, it is subjected to recall bias because we are using a questionnaire. and asking many questions from the past, the respondent may not recollect properly, which can lead to recall bias. So, these are the few biases which can affect the quality of a cross sectional study. So, overall, the cross section study is a very useful study design. Even though it has got a few disadvantages, the advantages of the cross sectional study outweigh its disadvantages. That is the reason these studies are carried out extensively throughout the world. Thank you. To summarize, cross sectional studies are an important study design which gives us valuable information regarding the prevalence of disease in a community. It helps us to understand what causes a disease. It helps us to find an association between a risk factor or a agent with the disease or the outcome. They are easy to do, requires less expertise, less money, and they are the widely used study design throughout the world. Even though we cannot do a temporal association between the risk factor and the disease, the information that is derived from the cross-sectional studies is vast and is very much useful for future research as well as for health policy development.